Madame Luisa Diogo. It's such a pleasure to see you. As the former Prime Minister, former Minister of Finance of Mozambique, you're in a fairly unique position to have a macro view of the dynamics across sectors. And one of the areas that I wanted to ask you is how you would advise the Minister of Health to position him or herself strategically in terms of other sectors, other cabinet colleagues, particularly in terms of the budget process and ensuring that the health budget is optimized in a way that the Minister of Health would like.
Thank you very much. I think that first of all, the Minister of Health has to know, to have an overall view of all the program of the country, not only the health sector, but have this overview, because the health sector is so important, and it's a sector that depends on the performance of all other sectors also. So health is, I think, the heart of the program of our government, because everything seems to begin there and end there. When a government is performing well, soon or later you can see the results in the health sector. When the government is not performing well in other sectors, soon or later you see the results coming down in health sector. So the Minister of Health has to have this overview of the program of the government in the different sectors, first of all. Second, it has to build alliance with the Minister of Finance, first of all, planning and finance, and second, with other sectorial ministers. And on that alliance, it has to pay more attention, for example, to the Minister of Water, Supply, Minister of Agriculture, so the ministries that are directly involved in the value chain of health sector. Yeah. So when the Minister of Health discusses with the Minister of Finance about the budget allocation, it has not to, it should not be done as the first and the unique moment. It should be one of the moments when they sit and they discuss. And the Ministers of Finance like to have good news, like to have programs that will help them to sell the budget in the Parliament. And normally, the program of the Minister of Health is key, because the parliamentarians are very sensitive to health sector. So this is a very important ally to the Minister of Finance. Should not be afraid or threatened by the attitude that apparently comes from the Minister of Finance, because the Minister of Finance normally is very defensive. And when you don't know how to approach him, you feel that he's being distant from you. But it's not true. It is the way how the Minister of Finance tries to survive. So show solidarity, first of all. Show that you understand his constraints. Try to ask him about the different problems and constraints. And later on, ask for something. He will be open and he will help you. If you have good news about the performance of last year, or last period of time, or last semester, or last quarter, if you have news about the future, so you can take them and use it as the basis to sell his budget in the cabinet and in the parliament.
Yes. Ministers of Health, as you indicated, are ruled by the heart, and they argue from the heart. Health is a life and death matter. And that resonates with everybody because we're all affected by it. But at the end of the day, the budget is about the head. You have to make hard and tough decisions based on economic realities, based on national priorities, etc. So, as a Minister of Health, coming to talk to the Minister of Finance, how do I allow the heart not to overrule the head? How do I create the balance between the two? Is it important, for example, to argue less about the life and death and more about the national priorities in terms of a broader development context?
I think that the Minister of Health should first of all continue being concerned with survival or death of the population. Otherwise, the country will be lost if it's ruled only by the Minister of Finance feelings. But the Minister of Health has to take in consideration the kind of audience and the sensitivity and the motivation of the other counterpart. And to understanding the motivation of a Minister of Finance, naturally, the Minister of Health has to try to discuss using the language of the Minister of Finance. Try to make the message acceptable and with the high level of receptivity from the Minister of Finance. So he has to use figures. He has to translate the figures into the life and vice versa. I used to say, make the dollars talk. And when the dollar talk says, I am making immunization of 10 children. So this dollar is talking. It's not a dollar per se. They are the life of those 5 children. So exactly. So he has to give this perspective to the Minister of Finance. And when he gives this perspective to him, he will start thinking to the same direction, parallel to the Minister of Health. It doesn't need to be at the same line, because one has a very clear motivation about saving lives and so on. The other one also, but needs to feel that there is an outcome, an output, an impact of the dollar or any money that he gives to the Minister of Health. Yeah.
One of the complaints that one hears from a Minister of Finance when one talks about health asking for more money is often that health is a bottomless pit, that there are many inefficiencies, there's waste, there's corruption, and yet the Minister of Finance is in a position, surely, to work with the Minister of Health to fix that problem. And so how does one create that partnership? And how, as Minister of Health, does one need to come forward willingly to acknowledge these inherent problems in the public health system and the need to be able to address them?
I think the Minister of Health has to be open with the Minister of Finance, not to hide the problems. Because sometimes the Minister of Health is afraid of showing the weaknesses. Is afraid of showing the weaknesses because he will not get the money. But the best strategy is not to hide, to go to the Minister of Finance and share the problems. But share the problems with a perspective of solving them. Saying, I have these problems, I'm addressing in this way, but what do you think? What would be the best way of solving this? Can you help me on that? Is it possible that your people would sit with mine and discuss? Minister of Finance likes very much that.
Help us build the capacity.
Help us build the capacity,
right,
so we can perform better. We can use better the resources, so scarce resources that you are assigning to us. So we can be more effective and do more with the same amount of money. So I think the openness, the transparency, the accountability also is very important. And sometimes ask the Minister of Health to make joint visits.
Yes.
The Minister of Finance has to ask, Minister of Health has to ask Minister of Finance to have joint visits, because Minister of Finance feels sometimes a little put aside because he isolated. He gives the money, and when it's a moment of inauguration or visit, no one remembers.
Invites him to the open.
Exactly. So sometimes go together with him, show the hospital, share the concerns and also the success. Because you have to encourage the other part. You know, the money you have given us, the objective was that, so look to this, what we have done. So we are thinking about inaugurating this with His Excellency the President or Her Excellency the President next month or next week. But you are the first coming with me. Let's see this, and the Minister of Finance will be really very glad to be part of the success and the results of his effort on getting the Treasury available to make things happen.
Yeah. Well, thank you very much.